The AHCA, American Health Care Act, which was introduced last week in the House as a replacement for Obamacare, is struggling as moderate Republicans join conservative members in voicing their opposition. The AARP has come out saying the impact on older Americans could be, quote, devastating as they're hit with skyrocketing premiums without sufficient tax credits. There's been criticism that the highest earners would receive large tax cuts and millions who use Medicaid would lose their safety net. But this week, we're paying attention to the impact on the 28 million people who are self-employed, many of them millennials and women over 55. Katie Velitzstra is with the National Association of the Self-Employed. It's nice to see you. Thanks for talking with us.
Thank you for having me, Soledad.
So give me the profile of these 28 million people.
So it's a really diverse group of people. So you have 28 million self-employed, or micro business owners, as we like to refer to them. So 10 or less employees. But they are running the gamut. They are young, as you mentioned, millennials. They are skewing a little bit older towards retirement age, and they have decided to go into business for themselves. You can imagine that their healthcare needs are also pretty diverse as well.
So then what does that mean in terms of how they're thinking about what's been proposed as legislation to sort of revamp healthcare?
So you have to remember, too, that about half of them are receiving health insurance, usually through a spouse, so like an employer-sponsored plan, but the other half are going into the individual marketplace. What they're really looking at right now is how are we going to drive down costs so that they can really afford those monthly health insurance premiums and take care of their family.
You've hated the individual mandate. You always refer to it as something like the evil individual mandate in every single thing I've ever read that you've ever said or written. The individual mandate, of course, requires you to buy insurance or you have to face a fine. That's now been replaced, right, by the continuous coverage incentive, which would essentially give a 30% penalty if you lapse, and that penalty would get paid to the insurance company, not to the government. So how do you feel about that as an option?
There is actually some movement within the House caucus to actually strike that provision from the new bill, and I think it's the right move.
What else do you see, would you say, needs to be changed in this bill?
You know, I think that where we're at right now is we're not really addressing the cost of health insurance. We're still trying to, as someone said, rearrange the deck chairs on the Titanic. That's not really getting at what the issues are. And where our members are coming at is, how can this be affordable for me? How does this make sense?
Not just the insurance, but the health care.
And how can we really look at some innovative ways to deliver health care and therefore would drive down the cost of health insurance?
Would you support the interstate commerce of basically selling health insurance across state lines? It always seems strange to me that that's not okay.
Absolutely. And in fact, that was actually one of the main reasons why we didn't support the ACA when it was introduced, was we didn't think it did enough to kind of promote interstate commerce, grouping of health insurance plans. And again, it gets back to the ability for a self-employed individual to really shop around and find what works best for them. And so again, this bill that the Republicans have introduced does nothing to kind of promote that interstate commerce, and we'd really like to see the Senate take that up.
Do you like the ACA better as it stands? Would you blow up the ACA for the AHCA?
I would not blow it up for what is being offered right now. And I think that is really the kind of, we're in between the rock and the hard place right now, is I don't think that the Republicans have done a really great job of explaining what they're trying to do. And I think they're very much trying to live up to a campaign promise where there are real opportunities to reform the ACA. And I think we're kind of missing the boat here.
Great. Katie, nice to have you with us.
Thank you so much.
Appreciate it. You bet.